Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic of today's Neighborhood Health Watch is living donor transplant. And perhaps the most important benefit is the psychological impact it has on the person receiving the organ. Doctors say recipients have a positive experience knowing the gift is from a loved one or a caring stranger, and donors have the satisfaction of knowing that he or she has helped improve someone's life. Dr. Kenneth Brown with Henrico Doctor's Hospital is here to talk more about it. Thank you a lot. Thanks a lot for joining us, Dr. Brown. You know, many people, thousands of people die waiting on organs from deceased donors. Talk about how this has revolutionized transplants and the benefits.
Well, as you mentioned, Diane, the large problem we still have in transplants is accessibility to organs. It turns out the organ availability over the years has been fairly flat. As many as 125,000 people are waiting in the United States for life-saving transplants, and we can only do about 30,000 transplants a year. And so with the deceased donor pool being flat, living donor is one of the main solutions.
And some of the benefits, a shorter recovery time, what are some of the things that people might consider?
Well, tremendous benefits from living donor transplant. We at the Virginia Transplant Center at Henrico Doctor's Hospital focus on kidney transplant, and we measure ourselves, as do many transplant systems, about results. And the results with living donor kidney transplants are superior to deceased donor. We measure, for instance, how long a kidney can be expected to survive. How long and what benefit is the patient going to get? Half-time is one of the concepts we use. That's about the time that 50% of the kidneys will still be working. From a deceased donor in America, it's about 10 years now. Living donor, maybe 15 years. So there's a significant advantage if a living donor can be found and used.
There's a certain risk inherent with any surgery. What are the risks involved here?
Well, as you say, there are risks. We focus at the Virginia Transplant Center on the individual. We are proud of the fact that we've embraced new technologies and have used laparoscopic approach to our donor nephrectomy, which is embraced throughout the country, but we use it exclusively. Shorter time to recovery, less pain. We try to follow our leader, Jerry Mendez's idea that it's really the human part that's going to make the difference, that's going to keep us and our patients close together.
All right, Dr. Brown, thank you so much for joining us here on First at 4.
Thank you for having me.